Good morning. Welcome to our part 2 session of paying for senior housing and long-term care, where we're focusing on veterans benefits this morning. Just want to do a quick check here. Mary Frances, can you hear me?
Yes, I can.
Awesome. Okay. Welcome. My name is Christine Drasher. I am one of your hosts for today's session. I'm also hosting with a couple colleagues from our organization called Cassia. I have Jean Andrews from the Apple Valley Villas. She is going to be with us today, actually at a virtual viewing with the Apple Valley Senior Center. So we welcome her and that group to our viewing today. And then also Kim Carpentier from the Regent. All three of us are part of Cassia, which is an organization that was created with a partnership of Augustana Care and Elam. So my organization or my building is Emerald Crest of Burnsville. We are a memory care setting. And you can see here, there's a picture of us. We're located in Burnsville, but we also have 3 other locations: Minnetonka, Shakopee, and Victoria. We are memory care only. We have 12 to 15 residents to a house, and we have different levels of dementia care. So we have an early stage program, a middle stage program, and a late stage program. And what makes us unique is not only our environment being very home style, but also that we have occupational therapists along with nurses that really focus on that person's ability rather than their disability, and really meet their needs of where they are with their level of function. You'll see there is all of our locations. Liz is our admissions director, and she's you can see her right there with her phone number. If you're interested in setting up a time to tour, feel free to give her a call or email. There is Jean in the picture of the Apple Valley Village. They are a beautiful building in Apple Valley, have been there for many years, and they have independent living, assisted living, memory care suites. They also have an adult day program in their building called Open Circle. They are connected to the Apple Valley Healthcare Center, which has skilled nursing, both long-term and short-term, and they can also do hospice. You can see their features here for their building. They have a receptionist available 24/7, which is really nice. So there's always somebody available in their building. They do daily OK checks, coffee and pastries daily. They have a chaplain on site with Bible studies and one-on-one visits. They have assisted living that can be received in any of their apartments within the building. So what's nice is you don't have to move. If you move in there and independent, you don't have to move to an assisted living apartment. So you can stay there and receive it. They have home care there 24 hours a day. They do have a nurse available 7 days a week, and you can see there that they can help with all those common services that most people receive in assisted living, like bathing, dressing, medications, physician coordination, and emergency response. Here are some of their amenities. They do have some beautiful community spaces, a chapel, a little deli convenience store if you don't want to have a restaurant style meal, fitness center, heated therapeutic pool, which is really nice, gift shop, hair salon, library, nail salon, medical services, outpatient therapy. What's nice is they do free vacuuming once a week. That's pretty neat. And then billiards and card room. It's a really nice location, very easy to a lot of the area shopping and restaurants in Apple Valley. And then our third provider that's co-hosting today is the Regent of Burnsville. There is Kimberly Carpentier. The Regent of Burnsville is probably the newest of the 3 properties that we have hosting today. They are located on beautiful Early Lake in Burnsville. It's been there since 2004. It's a very pretty location where it has some great views of the lake, and You can access the walking path very easily there as well. They have independent assisted memory care suites and respite services. Some of their community features is they have some wonderful social programs and spiritual programs. They have a movie theater, billiards, pub, chapel, exercise room, beauty shop, a library, some outdoor patio spaces, and a lot more wonderful community area spaces in that building. They're actually going through a full remodel in the next few months. So if you have been out there in the past, make sure you go out there and see them in the next couple months because they're going to have a new look. They have a wonderful restaurant style area where they do offer 3 meals a day plus snacks if you'd like them. They do have transportation as well. Like I said, you can access Early Lake if you would like to do some walking. It's a very safe and secure setting. And then their utilities are included, 24-hour emergency call system. They do allow pets as well. So you can see here some of their other wonderful amenities as well. With that assisted living, you can also receive that within all of their apartments, just like at the villa. You don't have to move out of your independent apartment to receive those services, which is a really nice feature. They have several different types of apartments to choose from as well, 2-bedroom, 2 studios. So a lot of different options there. So if you're interested in looking at their services, give Kimberly a call. Let's move forward to our feature presenter today, which is Mary Frances Price. For those of you who are not at our first session, I will just quickly speak about her bio here. Mary Frances is an attorney at law with Moss and Barrett. She graduated from the Mitchell Hamlin College of Law and received her undergraduate degree from Purdue University in West Lafayette, Indiana. Mary Frances has been licensed to practice law since 2005 and has counseled and advised hundreds of clients on their estate and elder care plans. Mary Frances focuses on her practice on serving individuals and families who are establishing an estate plan, revising an existing estate plan, or dealing with legal, medical, and financial impacts of aging, chronic illness, and disability. She has been accredited to practice before the Department of Veterans Affairs since 2008. Since that time, she has counseled and advised veterans and their families on accessing state and federal VA benefits. She is the author of a chapter on veterans benefits for the Elder Law Handbook, published by Minnesota Continuing Legal Education since 2012. Accordingly, her peers have recognized her as a leader in planning for veterans benefits. So I am thrilled to have Mary Frances join us from now on. So thank you.
Thank you, Christine. Good morning, everyone. Thank you to Cassia and Christine and her team for pulling this together and inviting us to be here today. As Christine said, I am a VA accredited attorney. All that really means is I went through some additional special training in 2008 so that I could have a separate license. I have a Minnesota law license, and then I have a license to practice, an accreditation to practice before the Department of Veterans Affairs. And so that's required of attorneys who want to work with veterans and help them and help the veteran and their family understand what benefits might be available and how to access them. You don't have to work with a VA accredited attorney. There are lots of other resources. The state of Minnesota and the Department of Veterans Affairs wants to make sure that veterans and their families know that family members can serve as a representative. If you were making a claim for benefits, you have a trusted family member, a spouse, a child who's got a POA, power of attorney or something, that person can be designated as a representative before the department to help process paperwork and make a claim. There are accredited attorneys like me. There are a handful of us around. We'll talk a little bit more about why somebody might need an attorney. And there are also something called accredited agents. Those are non-attorneys who've gone through some special training and testing to also have the same ability to be able to work with veterans and their families. There are accredited agents often available through veteran service organizations such as the American Legion and the Disabled American Vets. So there's access through those veteran service organizations for some free support for veterans and their families. And each county in Minnesota has in their Department of Human Services a county veteran service officer. In some of the larger counties like Dakota, like Ramsey and Hennepin, there are multiple veteran service officers. In some of the smaller outstate locations, there might be one officer that covers multiple counties. And in any event, that is an employee that as I said, that you access through the Department of Human Services to get help with processing claims for benefits, understanding what benefits might be available, and ordering discharge records and many, many things related to military service. So first, it's important to understand there are two main sources for veterans benefits. I'll talk about both today, and keeping in mind that we have some limited time together. What I'm focusing on today are benefits that would generally be available to persons over age 55 that meet certain service criteria. And so there are a lot of other veterans benefits, but this conversation is really focused on veterans benefits to help pay for long-term care for persons generally over 65, but may qualify at 55 as well. So again, we have benefits available at the federal level and also through the state. So it's important to know that if you're going to try to apply for benefits, there's some essential proofs or documents that you want to have handy. So if you're in the spirit of planning, if you have an acute need, or maybe you're just thinking, you joined us today thinking, maybe you're a senior worker and you help families, or maybe you're just curious about the topic and want to know how you can help people or yourself if you're a veteran or a family member. One thing you can do now is just make sure you have some important documents ready in the event you need to access benefits. So certification of military service is absolutely essential to access anything available through both the state of Minnesota Department of Veterans Affairs and the VA at the federal level. The most common form of that military service record is a DD-214. There are equivalent documents that would also suffice. If you do not have a copy of your military record or your loved ones, then you can request that it be reordered and certified through the archives.gov. So if you went on Google and typed in National Archives or archives.gov, it would take you to a website, and right on the first page, there's an option to order military service records. It can be done online. You can print off a paper copy, fill it out by hand, send it by fax or mail. In any event, if you don't know where your discharge record is, you can try to get it reordered, and it's a good thing to do to have a certified copy. Certified would be with a raised seal, or the original document with a raised seal. So if we're talking about benefits for spouses, Christine, we're going to jump to the next one. So if we're talking about benefits for spouses or dependents, you're also going to need to have a copy of the marriage certificate proving that the person is married to the person, the veteran. If we're looking at spousal benefits, if we're looking at benefits for dependents, then obviously you'd have to have a certificate of birth, a birth certificate proving that the dependent seeking benefits is linked to the person with military service. I put this on here because we're going to talk about, there's one program in particular called pension, commonly referred to as aid and attendance, but the correct term is non-service connected pension. That's a benefit that's only available to veterans who served during a wartime or conflict period. So I get asked a lot, what are the service date ranges that are relevant? Here they are, and we're going to take a look at example of a military discharge record, and I'm going to show you how you can find that information. So this is a copy of a DD-214. This is not a client of mine. I went on Google and I typed in DD-214 and a bunch of pictures came up. So this is a copy of a discharge record that's in the public domain. You can see here that at the top right-hand corner, it tells us the date of entry and the date of discharge. So that would be sorry, if you go down just below the upper right corner, that's where it details. You can see here, this is somebody who went in 24th of March of 58 and was discharged 5th of March 1960. So I can tell you right now that person has no wartime or conflict period service. Why? Because if we look at those service date ranges, the Korean conflict ended in January 55, okay? And the Vietnam era didn't start until 61. So that military record that we're looking at is what we call a gap person who would not be eligible for pension because they had service in between Korea and Vietnam. The other thing that's relevant on looking at your discharge record is the term of service. So if we drop down from those dates of service, this is the total time of service. So it tells us the net service for this period, 1 year, 11 months, and 12 days. So the number of days of consecutive active duty service matter when you're trying to figure out which programs you qualify for. And that's where you can find that information on a discharge record. I am often asked by, individuals who will say, I was married to a veteran for 30 years and then we got a divorce. And, I'm wondering if I can, access any veterans benefits like you can for Social Security. If you're married to somebody for a certain period of time, you can claim on their Social Security. The effect of divorce, it absolutely severs the former spouse's ability to obtain any benefits, period. So divorce just absolutely ends a person's ability to go in and make a claim for benefits, regardless of how long they were married or how many children they had. If somebody is married to a veteran at the time of the veteran's death, then they can make a claim on that person's record because the marriage ended by death, not divorce. However, if that person who was married to the veteran at the time of the veteran's death remarries, that may sever the person's ability to obtain benefits on the predeceased spouse's record. However, if they get a divorce from the second spouse, or if the second spouse dies, they can then go back and claim on the first spouse's record. So, effect of divorce, pretty straightforward. Effect of death really depends on the circumstances and whether or not the spouse remarried. If they're remarried to another veteran, they can have the opportunity to go in on that record. If they're married to two veterans who died, then they could go in on either person's record and might choose the one where they perceive they're going to get the highest benefit. So I'm going to jump into talking about one of the primary, some of the benefits available through the State Department of Veterans Affairs. We do have a body of rules, which can be found in the Minnesota Statutes, Chapter 9050, that governs our state level veterans benefits. Okay, so for you as a senior worker, a family member of a veteran yourself, that may not be relevant, but that's important. That's what helps accredited attorneys and agents understand, like, how do we do this in Minnesota? How do we access these benefits? What are the rules? Looking at a list of the benefits that are available through the state, it includes things like the Minnesota Veterans Homes. So Christine, I've jumped on to slide 10. So here's our list of state level benefits. Probably the first two I've listed are the ones that I deal with most commonly with my elder law practice, with my focus on persons over age 55. The Minnesota Veterans Home and adult daycare services. You can see that some other benefits that the Minnesota Department of Veterans Affairs can help people access, and I've got a link to their website there. So let's take a closer look at the Minnesota Veterans Homes. Currently, we have 4 locations for Minnesota Veterans Homes. These are skilled nursing homes. The locations are listed for you here: Fergus Falls, Silver Bay, Laverne, and Twin Cities. Ground has been broken, and we anticipate a facility in Bemidji and Montevideo in June of 23. I'm frequently asked about the facility in Hastings. That is not a skilled nursing facility. It is not a memory care facility. It's what's called board and care. it tends to be a population of veterans that are younger, and oftentimes people who are transitioning from homelessness, maybe have some mental health or substance issues. They're high functioning enough that they can live somewhat independently with a little bit of supported care. But in any event, this is not where you would typically see somebody over age 55 who needs skilled nursing care. That would be Fergus Falls, Silver Bay, Laverne, Twin Cities, and Hastings is really for a different population. So eligibility, I should note that Rule 9050 is in process with broad and sweeping changes that have been proposed by the Minnesota Department of Veterans Affairs. So the information I'm giving you today is accurate as of today and likely to change at some point in the next year or two. There was a hearing held before a judge. A number of us that are in the Bar Association that are accredited and work with veterans testified. Some of the changes are pretty drastic. So I just want to make sure you understand this information is relevant as of today, March 30th, 2022. But you'll want to keep a watchful eye. We anticipate some broad and sweeping changes. But as of today, in order to be eligible for admission to the veterans home, the veteran had to have served at least 181 consecutive active duty days or more. You have to be over age 55, so you can't be 45 and just looking for an apartment. You have to be in need of skilled care. I had a client probably 5 years ago, a veteran who was in assisted living. He was a widower. He walked with a walker. He got some assistance with setting up his medications, standby bathing assistance once a week, but he was pretty high functioning. He could get himself dressed. He could do most things. He was in an assisted living. An opportunity for him to move to the veterans home came up. He was on a wait list, and they did a clinical screening of him and determined actually he was too healthy. He was too high functioning. He did not meet the clinical level of care requirements to become a resident. So it is true that people can be denied if they're too healthy. It is true that people can be denied if they're too annoying, meaning or too at risk of injuring themselves or someone else. By annoying, I mean somebody who, let's say, wanders, and there now is a secure unit. But if there's no space available on the secure unit, and that's a specific need for that person, in years past, I've had people denied eligibility because, they can't. The wandering, the exit-seeking behaviors is not something that can be accommodated. They do have some ability to do that now, but in any event, you do have to understand that there's a clinical level of care that has to be met in order to be admitted. It is open to veterans and or the veteran's spouse, even if the veteran's living, but the spouse is the one with need. The spouse can go on the wait list and become a resident. I mentioned the wait list. The wait list has, for a decade for men, it was running anywhere from 6 to 9 months. During COVID, that really changed because there were a number of time periods where they suspended any admissions because of COVID. So I'm hearing numbers more in the 20 to 24 month range for male veterans. For females, it could be 36 months or more. Why is it so much longer? There are fewer female beds, and female veterans always take priority over female non-veterans. As an example, Minneapolis, the Veterans Home in Minneapolis has 340 total beds, 40 are women. So it's just the availability. So this is not something where if somebody just fell and fractured their hip and is coming out of 3 weeks of rehab and looking for a long-term care placement, you're not going to be able to call the vet's home and move dad in next Friday. Okay. It would require some advanced planning. It might be part of a longer range plan, but in any event, being mindful of the wait list would be important to note if you're looking at this as an opportunity. There are some significant differences. If you were with me last time, 2 weeks ago, we talked about medical assistance. There is a limit on the amount of assets somebody's spouse can have if they apply for medical assistance. Under current VA home rules, a person's spouse who's going to live at home can have unlimited assets. Unlimited assets, right? For medical assistance right now, the spouse can have only up to 137,400. Okay. So that's a pretty big difference. Resident can transfer assets from the prospective resident to the spouse up until the day before he or she moves in without penalty. So there's no look back period on transferring assets between spouses. The resident can decide whether or not they want to make income available to their spouse. So for example, let's say the spouse who's going to move to the vet's home has a pension and it's $3,000 a month, and the spouse at home has only $600 a month of Social Security. Then that resident can say to the admissions staff, I want to make some income available to my spouse. If the spouse elects to receive that income, then they can't be doing gifting, right? You can't say, I need income for self-support, but I'm going to pay for my son's divorce attorney or rent or cell phone, right? You can't be doing gifting if you're getting income from the resident of a Minnesota veterans home. Even though there are unlimited assets, there may be a restriction on the use of those assets. I had a client years ago who was receiving a spousal income allocation. Her husband was in the vet's home. She had a cat. The cat got very ill. She took some money out of a retirement account to pay for some medical needs, some vetting bills for the cat. The following year on annual review, the Minnesota Veterans Home reviewed and said, well, your income increased because you took that money out of your IRA. So therefore, in this following year, you're going to have a reduction in the amount of income you get from our resident spouse. So there are some limitations. There's some strings attached. If you get that spousal income allocation, the vet's home rules limit how and when and for what purpose you can use your assets. So I think the takeaway there is, if you're contemplating a move to the veterans home and there's a spouse at home, that spouse wants to think very clearly about how to handle their income needs. I've had some people that are allowed to get some income, but it's not that much. Let's say $300, $400, $500 a month. That's a lot of money. Don't get me wrong, but because they don't want to have the limitations on gifting or other restrictions, they'll decline to receive the income. So they're free of those rules. So I think that's something that would be important for anybody contemplating admission to assess. I should also add the look back period for transfers to non-spouses. So transfers to a child or children would be 1 year versus Medicaid, which is 5 years. Okay. Let's just take a look at an example of how these rules work. So here I have a veteran whose spouse needs care. They own an apartment building together. The apartment building is almost worth $950,000, and it produces $50,000 a year of income. But even that nice income plus Social Security is not enough to meet their skilled nursing needs. Here, under the current rules, if the veteran were to retitle the building in his name alone and move his spouse to the vet's home, then that apartment building would be disregarded. All of the income would flow to the spouse at home. There'd be no penalty for the transfer, and the spouse who moves in would pay a monthly maintenance charge based on her Social Security. Okay. So again, transfers between spouses are permissible and there's no asset limit. That's the point here. Let's look at a second example. We have a veteran who needs care, and he has an IRA, individual retirement account. That tells me that it's taxable, right? Every dollar that comes out of there is subject to an income tax. Spouse at home has almost no retirement. Okay. What do we do? Some people think, well, Mary Frances, you just told us that the veteran can transfer the $350,000 to his spouse. That's true, but IRAs are fully taxable. So let's say he did that, looking at, oh, well, I get to have my care covered if I transfer this out. What'll happen is his spouse is going to lose about 40% of the value of that asset year one. Okay. Because it's going to be taxable income, and it's going to throw that person into a pretty high tax bracket. So we'd have to, in order to determine if the vet's home move is sensible here, further analysis would be required. We'd want to look at what's the life expectancy of the veteran. Would it be more prudent for the veteran to move into a community-based assisted living or memory care or skilled nursing home and pay privately, drawing down that IRA? What's the life expectancy? If the family told me, well, he was just certified for hospice, and I would say, we're not going to cash that out because you might not outlive the tax hit that you take. You might be better off paying privately, even though that can be scary. So we'd want to look at those tax consequences of cashing out the IRA and calculate how many months would you have to live in the veterans home to realize a benefit if you're going to pay 40% income taxes on a major, withdrawal. So again, here's a situation where further analysis would be required. Next example, similar, identical facts. The only change here is that it's a 401k instead of an IRA. You might be wondering why I'm talking about this. Well, 401ks are federally mandated retirement plans. IRAs are individual retirement. So a lot of times when people retire, they'll roll a 401k. Oh, if we can jump back, thanks. A lot of times when people retire, they will roll a 401k into an IRA. But every now and then I work with somebody who has not done that. They have the 401k, and you are allowed to do a transfer, spouse to spouse transfer while you're married of a 401k, not an IRA. So here it might work to transfer. There's some legal steps that have to be followed in order to make that transfer happen. It's not like you just go fill out a form at the financial advisor's office or at Fidelity. It requires a court order, but it may be worth it in order to preserve the pre-tax character of that account. So again, I'm illustrating different options and why it might, these are examples. Remember when I said at the outset, why might somebody need a lawyer to help them with this? If you can go to the county veteran service officer, this is the type of analysis that really only an accredited attorney would be able to do in a compare and contrast to what private pay or medical assistance would look like. Okay. So these are specific examples where a family might benefit from some coaching. If somebody comes in and they have, $50,000 in a house, they may not need that level of assistance and might be able to just get what they need through the veteran service officer. So you can probably tell with regard to the veterans home, when we're dealing with married couples, then repositioning assets is going to be key to realize a benefit, meaning that if the rules permit unlimited assets for the spouse who lives at home, then it would be important for a family who's preparing for a move to go make sure that their assets are correctly positioned in the name of the spouse who will live at home. Now we do that, we move everything over to one spouse's name, we're going to have to update the estate plan. Okay, the estate plan of the person holding all the money and all the cards is going to have to be updated. So a typical community spouse estate plan would be what we call a spousal omission. Okay, spousal omission is, I'm going to sign a will that omits my spouse, because if my spouse is in the vet's home, then, and I die first, I want my stuff to go to my children or my charity. Okay, so under the current rules, that's permissible. It's permissible to omit your spouse. It feels kind of bad, but there might be a really good reason for doing that. Okay. So in any event, somebody whose spouse is going to move to the vet's home should also get the advice of an attorney to help them make sure that the assets are correctly positioned and that their estate plan is up to date for their current circumstances. There is something called estate recovery. We touched on this if you were with me 2 weeks ago. Estate recovery refers to if somebody receives medical assistance and dies, and then their spouse dies, that this estate of the spouse is going to be subject to a grab back for any Medicaid that was provided to their spouse during lifetime. So that happens after both spouses have died. Typically, historically, that has not been anything involved with the Minnesota Veterans Home. However, we are seeing that the Veterans Home is likely to move more toward forcing either estate recovery and or possibly what we call seeking an elective share. So if the spouse at home is holding all the assets and dies, and they have a will that says, give everything to my kids, elective share is if that spouse who's still in the vet's home, the vet's home might force that spouse to go say, get a piece of that estate, go get your elective share. That's a legal term of art that refers to the right of a spouse who's been omitted from an estate plan to go get a piece of it based on the length of the marriage. Okay. The other big benefit that I help people figure out how to access through both the state and federal VA. But here I'm focused on the Minnesota Department of Veterans Affairs Adult Day Program on the Minneapolis campus. There's a large, beautiful Victorian building that was converted into a modern adult daycare center. And veterans are eligible to apply and receive day activity programming services there. So that would be the same application as the Minnesota Veterans Home. It can be accessed on their website. And so if you're looking for adult day services and you live on the Cedar Avenue corridor and you're willing to either use Metro Mobility or provide transportation, that might be a really nice option. I mentioned here also that, you know, for some people that is just not a convenient location or the wait list is too long. The federal VA offers day programming benefits that are reimbursable to other community providers, for example, Open Circle. So it's not just the facility on the campus, you know, in the Minnehaha Falls Park, but there might also be some benefit through the federal VA that we're going to talk about next that can pay for adult daycare. So as I said at the outset, state level benefits, federal level benefits. We're shifting gears into talking about federal benefits. That means that if your friend lives in Arizona or Wisconsin and has veteran status, what we're talking about here would apply to anybody, regardless of what state they live in. The state benefits are specific to Minnesota residents. So here, the Federal Department of Veterans Affairs, which is the second largest government entity, it's a massive, massive entity. It's broken down into two main branches, what we call the VHA and the VBA. The VHA is the Veterans Health Administration, VBA is Veterans Benefit. In order to be admitted as a patient to the Veterans Health Administration to access hospitals and clinics, you have to fill out a form. Okay, that can be done online, on paper, and you have to have served at least 1 day of active duty and had an other than dishonorable discharge. Okay, does that mean everybody who served at least 1 day gets in? No. We're going to talk about how the VA may limit who gets in or what their priority is if they get in. So the Veterans Benefit Administration, we're going to talk about second, but that is like home loans and service connected awards and pension. So Veterans Health Administration, again, covers benefits through the VA hospitals and nursing homes. By the way, we have one federal VA nursing home in the state of Minnesota located in St. Cloud. Okay, we have a network of other nursing homes that have an agreement, a contractual agreement with the VA to provide coverage for veterans who have a service connected rating of 70% or higher. Okay, but there's only one true federal VA facility in our state, nursing home facility, and that's in St. Cloud. Veterans Health Administration includes prescription drug benefits, outpatient dental, blind and hearing. And our last bullet point here, access to home and community-based supports, is where in my 14 years of veterans work, I've seen an explosion in the benefits that are offered and for home and community-based supports. And again, that can include things like day activity, home care assistance, nurse home visits, and that's just to name a few. Okay, those are some of the more common ones, but there are certainly more out there. So Veterans Benefit Administration administers benefits, including the service connected compensation, home loans, burial benefits. That's a big one. A lot of people opt to be buried at Fort Snelling here. Life insurance and pension. Okay, we're going to focus on service connected compensation and pension here because that's really what applies toward elder veterans that are trying to figure out how to pay for long-term care. So I've used this term service connected. What does that mean? Service connected means that the veteran, him or herself, has a condition that was exacerbated or caused by military service. Once it gets to a certain level, it's recognized by the VA as a disabling condition and the veteran will receive monthly tax-free monetary distribution as compensation for the service-related disability. It is possible to be rated at 10%, or excuse me, 0, 10, 20, it goes up in 10% increments. If you're 0% rated, that's the VA saying, yeah, for example, you have some hearing loss and it's likely caused by military service, but it doesn't rise to the level where it impedes your ability to function. So hearing loss is a good example because somebody might be 0% rated, and then 5 years later, their hearing declines and they could be retested and it might jump up to 30%. Okay, so these ratings can be fluid. Once you get to 10%, you start getting compensated. I think the going rate is, $140 a month for a 10% rating, somewhere around there. At 100% rating, it's $3,300, $3,400, $3,500 a month. Okay, which is a lot of money, but it's also somebody who's pretty disabled or is an advanced disease stage. Once somebody's at 70% or higher, their long-term care will be covered through the VA to the extent that the veteran is willing to receive the long-term care at the VA or at a facility that has a contract with the VA. Ratings can go up or down over time. So, I've seen Vietnam era vets with Agent Orange exposure that have prostate cancer, 100% rating, treated for prostate cancer, it gets better. They're reevaluated, the rating goes down. Okay. Now, if it's something like, cognitive decline or dementia, that's not an irrevocable disease process, right? It's unlikely that their rating would go down. It probably would increase over time because that's a degenerative condition. So it is possible to have multiple ratings, 10% for hearing loss, 60% for heart disease due to Agent Orange exposure as an example. Okay. So that's what it means to be service connected. There's something called non-service connected. Okay. Non-service connected means the veteran or the surviving spouse of a veteran has a condition which is recognized as disabling and it impedes their ability to function. And it's not caused by service, it could be anything, right? It could be, I developed dementia. And if that veteran's service record includes 90 consecutive active duty days or more, at least one of those days had to have fallen during the ranges I gave you. And people say to me all the time, well, I was behind a desk in Germany, or I was in, I was in an Air Force base in Bismarck, North Dakota, and it doesn't matter. It just matters you were on active duty at least one day during a wartime or conflict period. It doesn't matter where you were or what you were doing. The discharge has to be other than dishonorable. And so a veteran who has that criteria might be eligible for this non-service connected pension, commonly referred to as aid and attendance. But as you're going to learn, that aid and attendance is a medical rating. It's not the program. The program is the non-service connected pension. When the veteran is living, they call it non-service connected improved disability. When the veteran dies and it's the surviving spouse, it's death pension. Okay. So, the VA, it can be complicated just in terms of understanding acronyms and vocabulary and where do I go and what program am I trying to seek? And that might be a reason to get help from a veteran service officer and accredited attorney. It's just really trying to navigate the system can be difficult. So let's take a look. For pension, I like to think of pension as kind of a long-term care benefit for veterans and surviving spouses that had wartime service. Eligibility is determined clinically and financially, just like Medicaid, just like the vet's home. Okay. When we're dealing with the VA, they have their own definition for income. Income for VA purposes, we call it IVAP. We're going to get it to an area of some slides where I'm not going to go through every single slide because I've provided examples that if you really want to delve in, you could look at those examples, but I want to hit the highlights of these programs and just be able to help you understand when or if this is something that might be useful for you, okay, or for clients you serve. So income for VA purposes, just somebody's gross income. That means before any deductions, gross income minus unreimbursed medical expenses. Okay, that's what we call income for VA purposes. Unreimbursed medical expenses, here's a list of what it might include. No big surprises here, okay? You know, unreimbursed medical expenses are also defined under the IRS, Internal Revenue Service, and so, or Internal Revenue Code. And so there's a lot of overlap there in terms of what constitutes an unreimbursed medical expense. Let's go to clinical need. For clinical need, okay, this is where, like I said before, you know, somebody could be too healthy, right? They may have some needs. In order to be eligible for pension, you have to be rated for what the VA calls housebound or aid in attendance. There's where that word comes in. Aid in attendance is a medical rating. Okay, when somebody applies for this program, they have to get a rating form completed by a doctor who has examined the person seeking benefits. We call them the claimant. And that will certify whether they're housebound or aid in attendance. Aid in attendance is a higher level of need. Housebound is a lower level of need. As you might imagine, aid in attendance would mean more money if somebody's rated for aid in attendance. Okay. Housebound is when somebody's really just like confined to their home and can't really get out that much without a substantial amount of support. Aid in attendance is somebody who needs a lot of help with their ADLs or has dementia or a related disorder, right? Cognitive dysfunction of some kind. So in terms of, again, let's take a look at the financial pieces. It's confusing, folks. This is where sometimes people will be referred to the attorney because, you know, these rules they changed in 2018. There aren't a lot of people who fully understand them, and it can be confusing. So for income purposes, we have to look at, you know, whether the veteran is married or unmarried, or is it a surviving spouse? Let's jump to the rate table. This says 2021. I'm sorry about that. You can cross that off on your list and put 2022. These are the 2022 maximum award level. What I mean by that is a surviving spouse applying for the pension, the maximum they could get, the maximum would be $1,318 a month. Okay, maximum. They might not get that much. I'll explain how you qualify. Single veteran and so on, you could see what the thresholds are. So even if you have a married veteran who qualifies, the most that veteran would get per month currently is $2,431. So that may be really helpful if somebody's in assisted living or memory care. Let's say they have a pension, some Social Security. This might be the little extra they need to continue to be private pay and not have to go on Medicaid. On the other hand, if somebody has, you know, $12,000 a month of nursing home costs, this might not cut the mustard. Okay, we might need to look at Medicaid instead. So let's go to the next slide. And I want to show you an example of how the income works. Here, if we have a married veteran who's in assisted living with their gross household income of $3,000 a month, deductible medical expenses, $5,700. So we subtract those medical expenses, that's minus $2,700. Well, the VA doesn't let you go into negative numbers. That's somebody who would just, for income for VA purposes, reportable income for VA purposes is $0. So we could expect them, if they're clinically eligible and asset eligible, this veteran would be getting a monthly amount at the maximum level. Okay, so that's how those income rules work. Now, assets, this is where there's been some really big changes. Up until 2018, there was no look back period on gifting. There was no net worth limit. Okay. In 2018, the VA came out and changed the rules and said, now you cannot have more than 130,773 in liquid assets. That does not include your house, car, personal property, prepaid burials. Okay. That's other stuff. So it's a pretty low threshold, and it's really low because you have to add your income to your assets to get your net worth. So why? I don't get it. I think it's stupid. I don't understand why the VA did that, but they require somebody to combine their annual income with their assets to come up with net worth. And if you're above 130, you're ineligible, not eligible. So if you have $20,000 a year worth of income, that has to be added to your net worth. We're going to take a look at an example of how that works. this is how lawyers work. We always give you the general rule and then tell you exceptions. One thing that is very exceptional and noteworthy is that a person's home plus the adjacent 2 acres are disregarded, not included in the net worth determination. And it doesn't matter if they're living in the house. So let's say somebody moved out of the house into assisted living, but their house is still in Apple Valley and they're renting it and they're getting some rental income. The value of the house is not included in net worth. The income might help them pay for expenses, of assisted living. But if they're going to apply for pension, the net worth in the equity in the house is not going to be counted towards net worth. And that's a big difference from Medicaid. Medicaid would say you got to sell that house. Okay. Again, personal effects are disregarded. A claimant doesn't have to be living in the home. However, if you do that arrangement, the Apple Valley house is being rented, I'm using the income, I'm getting sick of being a landlord, I'm going to sell it, then you have to report the sale and you're going to be probably taken off the program. So let's look at a net worth example just so you can see how this works. This is a very easy example, but I want to illustrate for you how this works. Married veteran with income of $1,000 a month, $12,000 a year, with available assets of $120,000, right? You add those 2 things together. Their income for VA purposes, $12,000 plus the $120 equals $132,000. That's the net worth for pension, and that's over the threshold. So this is a situation where the person would be denied. Now it's a ridiculous example because somebody in that position, I would say, go pre-fund your cremation or burial, and you go below the threshold and you're eligible. But I wanted to illustrate for you how adding the income to the assets is part of how you determine if you're eligible for this program. Okay. I provide some other examples in here. I'm not going to go through those. What I do want to do is jump to 41, Christine, the transfers and penalty, if we could. And here we are. There is a 36-month look back on gifting if you're going to apply for pension. This only applies to gifts or transfers that happened on or after October 18th of 2018. Okay. Penalty would be imposed back to the time where you made the gift. Okay. So if you made a gift 2 years ago, you're already 24 months into the look back period. Okay. So that's different than Medicaid because Medicaid imposes the penalty on the day you apply for benefits. So the VA does give a little wiggle room for gifts. But the maximum penalty would be 5 years, and you compute the penalty by the amount of the gift divided by the maximum annual pension rate. Okay. So part of that is going to just sound like total Greek to you. That's normal. Okay. This is pretty complicated. I think what I'd hope your takeaway from today is that there is a pension out there for veterans and surviving spouses of wartime era service that may help pay for things like home care, assisted living, memory care. And if that's something that you think you may qualify for, you'd want to get a little guidance from someone on whether or not it would work for you. Are there any, and this is where somebody might come and see the accredited attorney versus the county veteran service officer. If they're looking at legal planning and saying, well, how should I structure my assets? What should my will say? Can I move assets to my spouse? I made a gift 2 years ago to my kids. How does that factor in? It's those type of analysis and issues that somebody may, and again, if it's more simplistic than that, somebody has $100,000 in a house and they need some additional money to pay for assisted living, they might not need to see an attorney for that type of guidance. Okay. If we could jump to 46. And again, I put some examples in here of how a penalty would be calculated if somebody has gifted assets. Okay. That's what those slides are, if you want to take a look at them. I want to mention that annuities and trusts before 2018, there were a lot of people trying to sell annuities to veterans and a lot of people trying to establish specific asset protection trusts to veterans. the Department of Veterans Affairs and the Office of General Counsel, that's like the legal team for the Department of Veterans Affairs, they really have cracked down on these practices for both attorneys and financial professionals that were engaged in selling these type of products. By the way, they never worked in Minnesota, so it was never a part of my practice. But nationwide, they imposed some significant restrictions. And the only reason I mention it here is in case you have an annuity or a trust and are a veteran and are thinking about applying, that would be a circumstance where you'd want to get a little more advice on how is this annuity and or trust going to be characterized for purposes of determining my eligibility for pension. Okay. So I'm just keeping an eye on our time here. We're at 11:57. And I think what we decided, this is my contact information, by the way. I'm a private practice attorney. That's my direct email and phone. If you have a question or a future need, or if you're a senior worker that wants to help someone learn where to find me, this is where I can be found. And I'm happy to take questions. If you have any, you could put them in the chat. Or you could put your name in the chat and you can go live and ask a question if you have one.
Wonderful. Thank you, Mary Frances. While we're waiting to see if we get any questions, I will just have a couple notes here for you. So I think I put there on the next presentation we have is coming up on April 27th. So we're going to be talking with Sherry Eastgate, who is our expert on HUD and Section 8 from our Apple Valley campus. That'll be on April 27th. We'll do a Zoom as well. So if you haven't signed up for that one, you can do it the same exact way that you signed up for this one. So I invite you all to do that. And then I will also have handouts of this presentation along with the recording available online probably within a week or two. So if you are on this presentation, you will definitely get an email for that as well. So let's see, do we have any questions? Oopsies. No, you must have covered everything really well.
Yeah. Oh, it says, do these handouts include CEU info? Christine, I'm gonna let you.
Yeah, so I will have CEUs. I'm probably going to do them all at the end of the 3-part series. So email me if you need a CEU. So CEU would be for professionals in the healthcare industry who need the continuing education hours. So just email me. My email is there on that slide. And let me know what you need a CEU for, which session you attended, and we will get that out to you.
Another question just came in asking, how do I get paid? How does the lawyer get paid? So it depends on the type of work I'm doing. There are some limitations on what you can and can't bill for when you're advising veterans. But generally it's a private pay scenario. I'm just paid by a family privately to help them develop a long-term care plan, which may include guidance on Medicaid, long-term care, private pay, taxes, and veterans benefits. So it's usually a more thorough analysis. And if it's a situation where somebody calls and says, it's clearly not appropriate for me to be retained, then I will direct them to the Veteran Service Officer or other resource. But it's typically private pay unless I'm handling an appeal. And then in that case, I might take a contingent fee based on whether or not we're successful on the appeal. And that would be related to things like a denial for an increase in the service connected rating. And so those are more specific type cases. But generally, I'm working with elders and their family who are trying to access and build a long-term care plan. And that would be a private pay scenario. All right, I don't see any other questions coming in, but thank you again to Christine, Cassia, and all of the team members who joined us. And I always appreciate the opportunity to provide education around these important issues. And so I appreciate being here today.
Thank you so much, Mary Frances. Really appreciate it. Everyone have a great rest of the week. Bye.